Episode of Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi. Fired up as always. We are on AM 950 radio and got an interesting one for you guys today. So, as you guys know, for those of you that have been following me on social or just kind of follow what's going on, 2026 is kind of a year that is very special to me because it is the year where I'm really launching a lot of these ideas that I have been, just pouring over for the last several years and really trying to put it together in a way that makes sense so that we can help the maximum number of people. Now, you guys know that my goal has always been to help people as best as I can as a surgeon and then, as a physician. And then I got into integrative health, started the clinics, those types of things. But, the limitations on that are obviously that I can only reach the people that are coming in through my door. So the goal is really to find ways that I can spread a message to millions of people, things that I've learned, people that I'm around, and really try to help people, number one, become the CEO of their own health. Number two, really navigate the maze of the health system, which is so difficult for people to go through. And we're going to talk about that and some of the programs that are being launched this year, how you can get involved, and how excited I really am about it. And then on the flip side, I think that if we are really going to think about how do we fix the problem of delivery of healthcare right now, because you guys know this. I mean, there's a big survey out there that asked Americans, how many of them actually think that it's a good system that it's helping them, and the response is in the 20s, which means 70-something% of you don't think it is working. So there's two things we need to do. We need to get you guys more dialed in and become CEOs of your own health, understanding that ultimately you are responsible for yourself and that you really need to be involved in your care and you can't turn over your sovereignty. On the flip side, there's just as much trouble brewing or has been brewing amongst healthcare providers that are not in a good position. And those of you that are not in healthcare, I don't think that you understand how difficult a time healthcare providers are having, from physicians losing so much autonomy to so many other people being completely overworked. People have no time. They are becoming burnt out. The burnout rates are insane. We'll talk about that in a little bit. But the bottom line is, I think that my fellow healthcare providers absolutely need guidance, and we really need to help. And so we are launching something called the Sovereign Provider Mastermind. It is a national tour. We're going to be going from city to city. Depending on the size of the city, it'll be a 1 or 2 day teaching event where people can come. And the three primary objectives of the Sovereign Provider Mastermind is, number one, to help providers to reclaim their time. We've got some incredible speakers lined up as far as time management and what happens when you don't have your time. You don't have track of time. You just have loss of that. You can't build wealth. And healthcare providers, the amount of wealth that they build when compared to a comparative salary and some other thing is very anemic, and it is because they don't have time to set up the proper strategies. So we're going to be teaching that. And then the big one that's most near and dear to my heart, when it comes to health of providers, in general, providers are actually less healthy than the general population. I have talked a lot about the alarming statistics when we talk about mental health, suicide rates, and things like that. It's unbelievably alarming, and we need to do something about it. And this will be the first national tour, period, that combines time, building wealth, and building and rebuilding, reclaiming health. That's out there. I'm excited about it. This is launching later this summer, and we'll talk about it on the other side of the break. This is AM 950 Radio, Recharging the Human Battery. I'm Dr. Sinicropi. See you in a minute. right, we are back on Recharging the Human Battery Radio. I'm Dr. Sinicropi. This is AM 950 radio, and today this is really a special one for me because we've got to do something. We have to go in a different direction when it comes to the delivery of healthcare. I spend a lot of time talking to my patients about their ability to navigate the system. And really, people do need tremendous amounts of guidance. And we need to really reach out and touch millions of people and try to help them get through a system which, unfortunately, is not designed to get you better. I mentioned on the other side of the break that 70-something% of you think that the healthcare system is not designed, to get you better. And this is a huge, huge problem. And you're feeling it. Just to give you an example, and I'll give you example after example, and we're going to talk about a lot of statistics and things because this is really important. And, this is a PG show, so I'm going to keep it clean. But sometimes I just want to go, full expletive when I'm talking about these things because I'm trying to wake people up to how devastating the situation is and how a lot of it is absolutely because our minds have been brainwashed, our minds are hacked, and that happens again on the patient side of the equation, on the you side of the equation, but of those healthcare workers, that are out there, you understand how, it's also happening to you. And I can tell you, physicians and other providers are often some of the most brainwashed into thinking that the care that we are delivering is, ultimately going to result in excellent outcomes, especially when we think about chronic disease, people that have, chronic fatigue syndrome, all kinds of other, ailments are really not finding the help they need. So I'll just give you an example of why I can go, I literally could do 5 shows in a row and just give you examples of people. Yesterday I saw a young woman in the clinic. She's only in her 20s. She just graduated from college. And so what happened to her is that she started experiencing severe pain in the back of her head, right at the junction between her skull and the spine. And this became so severe, she almost had to drop out of school. Luckily, she was able to get through it. But now that she has been out for almost a year, she has gotten to the point where this pain is so devastating for her. Her and her mom were sitting in my office yesterday and talking about the fact that this is a 24/7 problem for her now. She basically lays at home, lays on the floor and cries, tries to stretch out her neck, has blurred vision, trouble with eye movements, headaches, but severe, unrelenting neck pain. And basically, she can't do anything. After she finished school, she was excited about starting a job. Can't do that. Really, really lost all, ability to do much. Now, here's the kicker. I get it. People get sick and they have issues. This one, to me, fairly straightforward. She has craniocervical instability, which can be common with people that have something called like EDS syndrome, but in other syndromes as well. And her symptoms are pretty clear that that's a big part of the problem after the exam and discussing it with her. But here's the kicker. She has seen a ton of doctors prior to coming to me. And once again, the stories of being completely blown off, we can't help you, your MRI is pretty normal, I don't know what's going on, this is all in your head. People pretty much just rolling their eyes at her, given everything she's going through. And this leads to people losing confidence in the system and not knowing where to turn, and where to go. But the mom was adamant about finding help for her daughter. So instead of giving up or turning over her care to people that they felt like were not going to do anything useful for them, eventually they were able to find me in the clinic, and we have a good plan and strategy for her as take care of a lot of these types of patients. And I think, one way or another, we should be able to significantly improve her symptoms, but it's just about getting a good diagnosis and then having a good plan and then building a support system that people can really count on, to help guide them. But even I told her, if she had walked into the office of a different spine spine surgeon or something like that, they would have been completely blown off. And it's not because the spine surgeon's doing anything wrong. It's just that the appearance of the films and everything else, it's just like there's so much work to be done in these cases where it's a big puzzle. And so we've got to put our Sherlock Holmes hat on and really work. And that takes a lot of time. And unfortunately, a lot of people are not willing to do that because the healthcare system is not set up that way. So when things are not necessarily black and white, it becomes really hard for people to be able to navigate the system. And it's heartbreaking. I can tell you story after story about people that have been completely blown off in the system. If we look at people like, Lyme disease, for example, Lyme disease, the mold illness. I mean, you're talking 6-7 doctors before you even get a diagnosis. And so this is it's really sad what's going on. And again, in these cases, people really need to step up to the plate, be CEOs of their own health, understand, exactly, what's going on with them and, make decisions. And so, first of all, I want to thank Margaret Duffy Wallace, a good friend of mine. She is a massage therapist actually from Canada, and got to know her a couple of years ago. She's fantastic. She actually started the Preventative Health Awareness Month in Canada, which is actually recognized by the government. I mean, really, really important stuff, because we just have to get this preventative health kind of movement going. But she's the one that originally kind of coined the term. Become the CEO of your own health. And it's something that she was nice enough to allow me, to use. And it's one of the subtitles of my book. And it's really the mantra. It really is something that I speak to, audiences now all across the country on becoming CEOs of their own health. And let's talk about why it is so important. And again, what I want you to take from this is you cannot just turn over your own sovereignty, your own thing to people, even when they have titles and they're experts, without doing your own research and making sure you understand exactly what is being proposed, what the kind of treatment options are, the guidelines. You got to think about getting second opinions. You have to think about getting opinions on those people to make sure that they're the right fit for you, because again, title doesn't mean that they are going to, guide you necessarily in a direction that you're willing to go in or is best for you. So always remember, you're hiring your doctors, your other providers as people managers, let's say, inside of the departments. So, for example, you might have a cardiology department if you have a heart thing. You might have a diabetes department, or we'll call it endocrinology department. You might have a renal department if you have kidney disease, etc. But those, you are ultimately the CEO, and so you have every right to go in and change them out. And I encourage you guys, if you are having that feeling in the pit of your stomachs, if you just feel like the person that is taking care of you is not the right fit for you, you are okay to move on. Some people feel so personal. They're like, well, this person's not helping me, but I've known them for a long time, so I feel really bad. I think they're... No, you got to find the right people. And you know what? I'm not the right person for everybody, and that's okay, because I have a certain plan and strategy and a certain style. It's not going to work for everybody, but for the people that work with me, I'm going to give you 100% of what I have and try to solve the puzzle and try to get you in the right direction. So let's set the stage here. Average doctor visit in the United States, 7 to 8 minutes long. And so if you come in and you say to me, hey, doc, I say, hey, what's wrong with you? And you say, hey, I have this or I have that. I'm really tired. I don't feel good. So then the doc says, okay, well, what's going on? You say, I feel terrible. Every day I wake up, even when I sleep, I feel severe fatigue. I have brain fog. I can't concentrate in the afternoon. I'm irritable. I don't feel well. I have trouble with my bowel movements. I have this, I have that. What, honestly, let's be honest. What are you going to do in 7-8 minutes? Honestly, what are you going to do? I would like somebody to explain to me what you do in 7 to 8 minutes. You can't do anything. I can't even start the conversation. Now, as a spine surgeon, yes, if you come in and say, I have horrible pain down my leg and you have a big disc herniation that we can treat with an injection or with surgery, yes, that takes about 30 seconds. to diagnose and say you have a disc. That's very easily understood. But the vast majority of problems are things like, well, I get headaches all the time. I don't feel good. I have all these I have rashes. I don't feel good. I have this and that. I'm swollen. What do you do with that in 7 to 8 minutes? It's honestly not possible, but that's where medicine has gone. And one of my taglines, which unfortunately is in a way it's offensive, but I don't know if it's offensive. You guys tell me if it's offensive. One of my taglines is I tell people to take out a pen and I tell them to write down the following. For people that are being, we think, right, you're 7 to 8 minutes, you're being assessed, right? An assessment. We call it an assessment, right? A patient visit. And I say, take out your pens, write this down. You're not being assessed. You're being processed. Okay? You're being processed. Kind of like like the meat going around, like at the meat factory, right? Just goes around in those hooks. We're just processing the meat, then we cut it up, then we put it in cans, then we send it out. This is how we are treating Americans in the current system. I know it sounds alarming, but it's just true. Now, we said the statistics before. I've said this a million times. It's 4.7 now up to $4.9 trillion a year spent treating, just the general healthcare ecosystem. That's a T. Please understand this concept of what a trillion is. It's big. It's very, very big when compared, and we don't like to think in these big numbers. So if you look at that, about 90% is spent on so-called sick care, and 3.7 trillion out of that number, okay, which is a lot of the 90%, is pretty much spent on chronic diseases. And so the question is, why is such a small percent being spent on preventative care? And this is a big part of the stuff I talk about, is if we put a lot more dollars, like, for example, if we went from 10% to 30%, there would be a dramatic drop in the number of people that actually become sick. And that is going to come through education, through setting up clinics, through setting up venues where doctors actually have time to go through these puzzles and do these things. You know how it helps? I mean, when it comes to chronic illnesses and things like that, it is a big puzzle. And so that's why I know that I would never be able to do that in a standard setting. So in my spine clinic, I evaluate spine patients. In many ways, those are much, much easier to evaluate. But when it comes to people that have chronic disease, I couldn't be happier with seeing patients at the Integrative Health Clinic, because there I spend an hour with patients, sometimes an hour and a half or more, really understanding who they are, what they've been through, and then crafting a plan, then getting a series of very extensive labs, and then taking that and then coming back and having a session with them to craft an even, bigger plan and strategy. So this really has to be the philosophy. You need to know what's available and what's out there. So what is the overall, philosophy of what I'm trying to get to you guys? You have to absolutely take your health into your own hands and understand that for certain types of conditions, for the most part, it's going to be very difficult to get the care that you want inside of your usual traditional, going to your primary doctor. Now, by all means, continue to go to your primary doctor and get your preventative tests, get your colonoscopies or do Cologuard, get your prostate exams, get your mammograms, get all those things. I'm a huge believer and proponent in preventative measures that are done even in the traditional system. They save millions and millions of lives. But when it comes to really solving the puzzles, if you're chronically ill, you have to get into a setting where there is time and the effort can be made to try to help guide you, to getting better health. And honestly, unfortunately, it's difficult to find it in the traditional system. And sometimes you will have to invest your own, dollars into these types of, strategies and plans in order to get your health back. We developed this incredible calculator, and it is a calculator that basically shows you're able to plug in kind of what your salary is, if you're a business owner, if you've got employees, if you've got this and that, and it will calculate for you based on your income levels or how much responsibility you have, this and that. It'll calculate an estimated amount of money that you lose for, let's say, every week of disability that you are out or when you can't work at your maximum abilities. And so really fascinating. And so I encourage you, if you see it coming across, from me, take that score and see how devastating it can be. And I've seen people go from, very functional and having healthy and happy lives and being, very much in the middle of a career or having businesses and things like that, and everything is taken away. I can't tell you how many stories at the Integrative Health Clinic when people are first coming to us to seek help where they're just telling us, I'm losing my house. I had to sell my house because I had this illness. I lost my business. I lost everything. So preventative. And for those of you that are, managers or CEOs of your own companies, there is a great, survey out there that showed that 72% of CEOs report that health, their own health is going to affect their overall business performance. I mean, these are real statistics, and that's not to mention the if their employees get sick, how that affects them. But obviously, when the top person gets sick, it's usually the most devastating. So we have to be CEOs of our own health, and it doesn't matter at what level you are. Once you get sick, you're in a bad spot. You need to think about, like, as the CEO of your own health, what are the things that are associated with staying healthy? Now, most of it is very basic, right? It's what we put in our mouths. It's what does our diet and nutrition plan look like? What does our sleep plan look like? What does our movement and exercise plan look like? What does our spiritual health and mental health look like? And we have to really take into account. There's really simple things that people can do. I mean, there's two biggest predictors of mortality. Very simple. VO2 max, right? That is your ability to process oxygen. These can be done easily at places like Human Powered Health. They do a great VO2 max testing, and that is a big predictor of longevity. The second one is how much muscle you maintain on your body. Muscle mass and keeping muscle and keeping strength is a huge predictor. I mean, there's been studies on grip strength and other tests and measures of maintaining strength, which absolutely are going to correlate with your the ability to live a long and healthy life. So going back to being CEO of your own health, there's just simple measures that we can do to see where we are. I can tell you the vast majority of people that come through my door, and I ask them, well, what are the metrics? Like, what metrics are you looking at to look at your health? The vast majority of people, it's literally zero. They're not looking at their heart rate variability. Forget VO2 max or any of this stuff. They're not getting DEXA scans or other scans to look at their body fat index. They're not looking at what their bone density index for. We can go on bone density for a long time. They are not looking, for example, like when it comes to cardiac situation, at things like lipoprotein B, which is a stronger predictor of cardiovascular risk than LDL cholesterol. If for those of you guys, and I'm not trying to alarm people, but 50% of people that have heart attacks have normal cholesterol. So we have to look at these advanced lipid markers to really give you an assessment of how much you are at risk. And again, this is very seldom done. A good friend of mine, he's actually a cardiothoracic surgeon and a lipidologist. He's out in California. He has his own company, does a great job. It's called Paladin MDs. And they help guide people on their health journeys. And, he is a big proponent of having these for almost everybody, because if you don't know, you don't even know your cardiac risk score truly by just getting the standard tests. Look at vitamin D. I'm just talking basics, guys. I'm just trying to tell you how poor we are at keeping you guys healthy. Think about that. I'm a doctor, and I'm telling you, as doctors, we are doing a crap job of keeping you healthy. If that doesn't ring alarm bells, I don't know what does. And again, I'm an insider. I'm not a conspiracy theorist. I didn't learn this at the gym. I learned this through 20 years of being a surgeon on my own, as a CEO, running, multiple companies, looking at the healthcare system as it is. And I'm telling you, we're not doing a good job. A couple more simple things. Vitamin D levels. 70% of Americans are deficient in vitamin D. There are so many diseases that if your vitamin D levels are low, you are going to have a really difficult time recovering. It's really intimately involved in so many different processes in the body. It's just fascinating to me how many people come in with tremendously low vitamin D levels. So when you look at the everything I'm talking about here, I'm just talking about the simple things. If I had more time, I would go really into very deep details on all these different diseases and why we are not doing a good job and why we are not equipped to do a good job. So what are we doing? What are all the strategies that we've launched? Now, the first thing that I've done personally is done the integrative health clinic and the wellness centers. But again, that's only if you decide to come and see us. What we are committed at Hypercharge, Integrative Health to absolutely solving the puzzle of your chronic disease. We have a lot of biohacking strategies. We do traditional medicine. We do all kinds of stuff. We might send you for Chinese medicine. We have a stem cell clinic. We do all kinds of things. But again, those are people that come through my door, so I can't control that. I control a little bit, but not to a large degree. The next thing is really getting the book out. Wellness at the Speed of Light comes out here hopefully later in the summer or early fall. Right now it's a moving target. I'll explain that another time with these book editors. Wow, is that painful? That's not neither here nor there, but that book is coming pretty soon. But the big launches are these program. So we are building a community. You're going to see this announced here in the next 2 weeks. The name of the community is called Above Genetics. It's something that you guys will be able to basically tag in on and be part of a community where we have weekly sessions, mostly led by my partner, Dr. Carrera, who's going to be doing a lot of this stuff where we talk about your health and ways that you really can manage this. And there'll be different tiers to this, so it depends on how dialed in you want to get. You can go up the line all the way up to having a assessment and life plan really put together. And then really even above and beyond that, one of my passions as a human being is I am obsessed with figuring out really complex puzzles. And so the more complex people's health situation is, the more I want to be involved, because that needs a different type of mindset, a different type of creative and out-of-the-box thinking. And we're all different. Some of us, everybody's got a different skill set, but that, solving puzzles is something that I can't be more obsessed with. And so the launch of my CMO program, which is basically Chief Medical Officer. It's an advisory program where I work directly, and they're not my patients, they're clients. They can be anywhere in the world, where we can help to advise them on their health choices and decisions. I use my network of thousands of people across the globe to be able to really set up and connect people with experts in whatever thing they're going through. If they have a hospitalization, we can help to manage it alongside them by communicating with their physicians, communicating with their consultants, et cetera, to make sure that they are guided in the right direction. And that is that, it's a CMO program. It's called the Sinicropi Advisory. I can't be more excited about it. But again, with all these different tiers and structures, the goal is really to eventually reach millions of people and help them to become truly the CEOs of their own health, but also to think about having a guide for them as a CMO of their health, Chief Medical Officer. You're going to be hearing a lot from me on this. Again, I'm going to say it again, Chief Medical Officer. You want to think about having a Chief Medical Officer in addition to yourselves as being the CEO of your own health, having somebody next to you. I will tell you, people that have guides to get through the complex system that we have created, a system that is designed to keep us sick, a system that is designed to keep us confused, a system that honestly is keeping the providers confused and in silos and not really truly understanding what's going on and the downstream ramifications of what's happening to people. And I really think that it is a dramatic difference if you are educated and you have a guide, to help you through it. So happy to take any questions. Please leave those down below in the comments when it comes to this strategy. Now, I want to get on to another really deeply, important topic to me, and that is my fellow healthcare providers. I've been thinking about this for a long time, and I'm really excited that 2026 is the year of the launch, and I have so many people that are so excited for this to launch. This is coming. I mean, this is just a few months away, and I'm excited. And we will be having a Sovereign Provider Mastermind event here in Minnesota. We're likely targeting late September or early October for that event. So look for the announcements, which should be coming relatively soon on the first three cities tour. Again, the first one's going to be in LA, and then second in Minnesota, and then we'll announce the rest of the tours. I don't want to give away too much right now. So why am I so concerned about healthcare providers? So, we've talked about this before on the show. We talk about the me and you zones, right? I always say, it's the last chapter in my book. We've got to take care of me so we can take care of you, right? You guys understand this. It's just the play on the blue zones. But healthcare providers, because of the way we're built, the way we're taught, the people that are around us, we tend to always think about the others around us. We pour everything that we have into our patients, into our practices, and unfortunately into dealing with administration and electronic medical records and this and that. And it gets harder and harder as providers lose their autonomy. It's very, very difficult. It's a difficult environment. Bottom line is, what I think it's similar to is, moms. Right, in a family. I mean, how many moms do you guys know that give everything, but they don't take care of themselves? They literally give everything for their children, everything for their husbands, everything. And then they also sometimes are taking care of their own elderly parents. They give everything, and their life can fall apart. They can get mentally and physically ill. Certainly they're almost never thinking about, finances, unless the finances go so bad that they can't, take care of those people. And let's not even talk about time. They have no time. This is exactly what is happening to healthcare providers in our society. A lot of them give everything. I'm around some amazing nurses. They give everything. And the pandemic really brought it out. And I don't want us to forget how we were celebrating nurses and, during the pandemic. Everyone had, their signs outside the front. Healthcare providers are heroes. Well, I can tell you that went away real quick. So I want people to get back to that and really remember those times. But other folks, dentists, chiropractors, all these people, now nurse practitioners, physicians, physician assistants, they give so much of their own time, effort, mental effort, that then they forget really important things, and that is to take care of themselves. And so there's really three big things that we are going to be teaching at this Sovereign Provider Mastermind. And I really do, if you are healthcare providers and you're listening to this, or you have family and friends that are healthcare providers, please put the Sovereign Provider Mastermind on their radar, because I'm telling you, when they come into the mastermind, when they come out of it, they are going to come out thinking differently. We have a lineup of speakers that you wouldn't believe, phenomenal people that are really going to teach all of us how to be better in our own lives, because when we're better, we're going to actually end up being better for others. We have trouble thinking about ourselves and working on ourselves. I know so many healthcare providers that are so selfless, but it's to their own detriment. They're selfless to the point that they get sick. That doesn't make any sense, because we need you to be around feeling good so that you can continue taking care of people. We can't have an entire healthcare workforce that has no time, is broke, right, and is sick. Does that make any sense? That makes zero sense. This is what's happening. It's the most obvious thing. Come to the doctor's lounge. I'll show you. I will literally show you. So anyway, without getting too crazy, let's think about this for a second. I just want to look at some of the statistics, and I'm going to look at a couple different things. I can't cover anybody, so I'm not trying to leave anybody out. Physicians, it's almost a 50% rate of active burnout. 50. That means 50% of physicians right now, they feel like they're shot. Okay? Their lives are not going the way they want it to be. 70% have contemplated an early retirement or a complete career change. Do you want all the doctors to leave and go do something else? Here, I'll give you a different one. Do you want the doctors to be thinking, while they're taking care of you, that they don't want to be doing what they're doing? This is exactly what's happening right now. I'm just going to call it out. It's the elephant in the room. You guys, we got to wake up. And I don't care. It's just true. And so when I post things like this, if people just think, hey, this guy's, just saying the wrong thing, it's not. This is true. These are statistically true. 24.3% divorce rate amongst physicians. That is completely driven by the relentless demands of the profession. If you look at dentists, 82% of dentists report major stress and career burnout, and they carry an average of $300,000 in student loan debt. Come on. I mean, this is all, and we could just look at all kinds of stuff. 70% of nurse practitioners feel burnt out or depressed. You hear what I'm saying? 70, not 7, 70. 35% of physician assistants share, have exhaustion, with the worst being the emergency medicine, PAs. Female nurses, 2 times the average rate of the general female population of suicide in female nurses. Now you put female doctors on there, let's kick that up to 3 to 4 times the rate of the average population. The system is fundamentally broken. We have no time. These people are not building wealth because they have no time to think about legacy, to think about investments, to think about all these other things. There's nothing wrong with providers thinking about money and taking care of their family. After all, they sacrifice enough. You don't have to sacrifice literally your life, to do what you're doing. And so we really need to think, about these things. So we need to talk about the 3 pillars quickly. Pillar 1 is this concept of time. We are going to bring in masters of time management, which are going to teach you how to use AI. AI is amazing. How to automate things, how to use assistants and administrative support staff for you to minimize clinical burnout, how to navigate the system, but also, more importantly, how to make your schedule so you schedule around personal time, family time, vacation time, and then you build your schedule around that. 95% of you, no chance that you're doing that. I see you day in and day out. You're just trying to take care of people and work more and more and more, and that leads to burnout. The second pillar is building up your capital. Now, when it comes to building up your capital, I can tell you that healthcare providers are amongst the least educated people when it comes to taking care of their own finances, doing things like multifamily real estate, setting up trusts, setting up legacy. And I know you're thinking, oh, that's only for rich people. Wrong. You have to think like rich people in order to get those same tax benefits and all those things that they do. There is a reason that they got to that point. They're not hemorrhaging money left and right. And I am telling you that the average net worth of most people in the healthcare industry compared to what they make over their lifetime is, I'll just be honest with you, it's pathetic. It's embarrassing. And then they end up with the wrong financial advisors and all these people that are telling them the wrong things, and it becomes a disaster. And so there are so many, I'm telling you, just like athletes, there are so many physicians, physician assistants, nurse practitioners, dentists, all these people that end up completely broke when they're retired. They're just living off of Social Security, but it wasn't like they didn't do anything in the interim. They gave up pretty much their whole life in the interim, and now they're broke. So let's think about ways to change that, because they're going to be better providers if they have financial stability. The last one is its own segment. It's its own show. But pillar 3 is rebuilding the health. Like I said, man, even though we are spending all our times trying to help the health of our patients, we are not healthy ourselves. Like I said, come to the doctor's lounge. You'll see what I'm talking about. It's the brutal truth. And when I confront healthcare providers with it, it often results in a lot of tears because they realize that their health is in complete disrepair. So we are going to teach things about, staying in parasympathetic states, doing things for mental health, physical health, thinking about things like stem cells and peptides, biohacking, and all kinds of other advanced treatments. So on the other side of the break, we'll talk about what is the convergence between these two things that we are trying to build to help millions of people. We're on AM 950 radio. This is Recharging the Human Battery. We will see you in a minute. All right, here we are in the last little segment of Recharging the Human Battery radio. This is AM 950. I'm Dr. Sinicropi. This has been, tremendous, opportunity for me to talk to you guys about what I am trying to achieve, how we're trying to reach millions of people and really change lives. And this is something that I'm telling you, I've lost so much sleep thinking about the way to bring these ideas and these strategies to millions of people that are trying to navigate their own health, their wellness, their longevity, but also bring it to millions of the people that are trying to take care of you globally, because I think that providers are in a very difficult situation right now where they are fraught with burnout. They are second guessing why they even got into the profession. 70% of physicians would not recommend the profession to the youth, which is very sad, to me, having a kid that is a pre-med and wants to be an orthopedic surgeon. I am a strong proponent of the young people going in. Despite AI and robotics and all the things you hear Elon Musk saying, believe me, it is still worth it to go into this incredible profession, and will morph with the change in technology and such. I think that the overarching messages here on the layperson side, I really want you, if you've listened to this whole episode, think about an assessment. Sit down at your kitchen table, take out a pen and paper, write a couple columns. In one column, just put down what you're actually doing to assess your own health and then do something about it. And then on the other column, just write down, just do this as an exercise. Just write down what you think at least you should be adding to your, your daily strategy, your weekly strategy, your monthly strategy, just how you conduct your life and what you're doing, how you're choosing your healthcare providers and stuff. Just write those two columns. What is actually happening now? Really take a take an autopsy of your life and what you are doing to keep yourself healthy and well, and then put on the other side what you think you should be doing, and then start getting to work doing the research on how you can really help yourself become a true CEO of your health, and then hire the right people underneath you. And I'm telling you, this will absolutely 100% change your life. If you want to take it to the next level, I would encourage you to join movements like we are creating at Above Genetics. Come on in and think about whether or not you want to consider putting a CMO on your team, and whether that be like in a low level way or in a kind of a 24/7, you want somebody to guide you. Those things are all available. And if you are healthcare providers out there listening, number one, I want you to really listen to what I said about people taking ownership over their own lives. You guys need to be teaching this to your own patients. If you don't have the time to do all these things we're talking about, at least teach them to take the matters into their own hand and be educated and do the research and really control what they can control. But more importantly for you guys, I am really trying to help you in this sovereign provider masterminds. We're going to be all over the country. Please, 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 please consider coming to one of these events, bringing your whole self, and I will tell you, it will make a big, big impact in your life, the way you see things, helping you to organize yourself. You will have more time. We will help you build more wealth, and we will certainly put you on the right direction for your own health, which, like I said, you are not paying attention to enough. And if you break down in any of those three categories, you're going to be completely burnt out. And guess what? Your patient care is going to suffer. You're going to suffer. And everybody around you is going to suffer. So together, let's focus on the lay population that's out here. Let's help them, guide them through the maze of what is healthcare, and let's help the people that are actually running the healthcare system to guide themselves and then better help them to guide the patients through the healthcare system. I think if we put these two things together, we can build an entirely new way of thinking. We can build a much healthier future for ourselves, for our families, and for future generations. So hopefully you enjoyed this one. I couldn't have enjoyed it more. This is Recharging the Human Battery Radio. I'm Dr. Sinicropi. This is AM 950, and we will see you guys next week.